And thank you for staying with us. Weakness, numbness on the face, arms, or legs are some of the symptoms and sign of a stroke. And continuing in the conversation that we had with Jessica and her mother a little bit earlier, we welcome now Dr. Kathryn Kirchoff-Torres. Is that correct? Did I say it correctly?
Yes.
Okay, great. She's here to tell us a little bit more about the resources that are actually available for prevention and care. And thank you so much for coming and sharing with us.
Thank you for having me today.
Thank you. And sometimes, as Jessica talked about a little earlier, when it comes to stroke, sometimes people don't even recognize the signs. And before you know it, stroke is upon you. And stroke is something that many people sometimes just really don't even know too much about. So give us a little bit more of awareness here.
Absolutely. So a stroke is an interruption of the blood supply to the brain, either due to a blockage of a blood vessel to the brain, such as in Jessica's case, or due to a rupture of a blood vessel causing bleeding within the brain. And it's important for everyone to be aware of the symptoms, which can include weakness or numbness on one side of the body, drooping of the face, slurring of speech, loss of vision in one eye or on one side, or a sudden change in balance. There's an easy way to try to remember the symptoms of stroke, and we use the term FAST, F-A-S-T. So F stands for face. If you ask the person to smile and you see that their smile is crooked, that could be one sign of stroke. Arm, you would ask the person to hold out their arm, and if it drops or is weak, or if the leg is weak as well, that would be another symptom. S stands for speech. If you ask the person to speak and their speech is slurred or doesn't make sense. And T stands for time to dial 911. So that's an easy way to remember the most common symptoms.
And when you talk about the time to dial 911, it is very important for people to dial within a specific amount of time. Am I correct?
Absolutely. So the quicker, the better. The resources that we have to treat stroke, which can include either an IV blood thinner, a special type of blood thinner that we can only give in the emergency room immediately after start of stroke, or procedures that are done by catheter to try to remove the clot from the body, have to be done immediately to prevent further damage.
Mm-hmm. So the key is really getting called the 911 early and things like that. So talk about prevention. Obviously, are there some things that can really go in the area of stroke prevention? I know that for some people we talk about smoking, and smoking can be a real big cause.
Absolutely. So smoking is one of the risk factors for stroke. It's important to know for each individual person what are their risk factors. And the most common for both the ischemic stroke, which is a type of blood vessel blockage, or bleeding, is high blood pressure. Mm-hmm. High blood pressure is very prevalent, and it's one of the things that can be easily treated ahead of time to prevent stroke. Other things that are important to treat are diabetes, high cholesterol, and an irregular heart rhythm called atrial fibrillation. Mm-hmm. So I think the most important message is to have regular follow-ups with a primary care doctor who's managing these risk factors before it leads to the stroke.
Absolutely. So the key is really just get checked out and stay checked out to really be there. Now, for people who've been victims of stroke, I mean, a lot of times there's this, this heavy weight because a lot of people think the stroke, once you've had a stroke, you cannot recover. That's not true.
I'm very happy to say that if you came to my waiting room, most of the people that you would see on the street or in my waiting room really look normal. Mm-hmm. So there is great potential to recover, but it is a difficult process, and people require both support for their medical risk factors as well as the psychosocial impact that it has on them. So it is really important to feel it's not futile. It is important to get help quickly, to continue to manage your stroke risk factors, so hopefully you can make a good recovery and not have a relapse.
What are the main resources that are available right now for somebody to find out more information, because this is Stroke Awareness
Sure,
Month?
yes, absolutely. So the American Heart Association, American Stroke Association, which is strokeassociation.org, is a website which has a lot of information about the stroke risk factors, warning signs, treatments, and prevention. The National Stroke Foundation as well has a very informative website with this information.
Is there a particular demographic that is more susceptible to stroke, are you finding?
Well, it's interesting that you ask that. There are some studies that suggest that ethnic minorities may be at a higher risk for stroke, but stroke is something that really does not discriminate. People of all ethnicities, ages, and of all different socioeconomic levels are at risk for stroke, so it's important to understand for each person what their risk factors is and to be aware of that.
So for more information, we want to make sure that you get connected. You saw the information at the bottom of the screen so you can find out more about stroke. And so all throughout the course of the month, I guarantee that there are going to be events and things like that going on, giving people
Yes.
more information.
Yes.
All righty. Well, thank you, doctor, for coming and sharing with us and learning a little bit more about stroke. May is Stroke Awareness Month, and we want people to know more about it. And so, as you said, check on to the American Heart Association. You can also check the stroke website, get all the information that you need. Taking a quick break. We got more open coming up right after this. Stay with us.